Good afternoon, everyone. My name is Taina Figueroa. I am a registered nurse and I attend the St. Petersburg College RN to BSN program. Today, my presentation is titled Effective Hand Hygiene Practices, a Literature Review. Hand hygiene is one of the simplest and most effective ways to prevent healthcare-associated infections. Yet poor compliance continues to be a major issue in the healthcare settings. Despite years of education and guidelines from organizations such as the World Health Organization and CDC, compliance rates among healthcare workers remain inconsistent. Poor compliance contributes to healthcare-associated infections, also known as HAIs, which continue to affect patient outcomes and increase healthcare costs. The purpose of this literature review is to examine factors affecting effective hand hygiene practices among healthcare workers. The World Health Organization introduced the 5 moments for hand hygiene to guide healthcare workers on when hand hygiene should be performed during patient care. These moments include before patient contact, before aseptic procedures, after body fluid exposure, after patient contact, and after contact with the patient environment. Even with these guidelines, compliance rate remains low in many healthcare settings. Studies suggest that education alone is not enough to improve long-term compliance. Other barriers such as heavy workload, glove misuse, lack of supplies, and poor role modeling also contribute to poor hand hygiene practices. Because of this, long-term strategies and system-wide support are needed to improve compliance and reduce infection rates. For this literature review, articles were searched using the SPC Library, PubMed, and Google Scholar databases. Keywords included hand hygiene, infection prevention, healthcare-associated infections, and nursing compliance. The inclusion criteria were peer-reviewed articles written in English and published within the last 5 years. 3 research articles were selected for analysis because they addressed different factors related to hand hygiene compliance, education, and infection prevention practices. The first article was conducted in South Africa and focused on healthcare students' perceptions of hand hygiene education and practice. This study is considered a level 6 study because it used a descriptive cross-sectional design. Researchers used a self-reported online questionnaire distributed to healthcare students at a South African university. 464 health science students participated, and that included the nursing program. The purpose of the study was to evaluate students' hand hygiene knowledge, skills, and practice in a clinical setting. The study found that students had high knowledge scores at 76%, moderate skills at 54%, and low practice compliance at 37%. Students reported high use of alcohol-based hand rub, and many stated that their hand hygiene increased after COVID-19. Nursing students scored higher than students in the sports and movement studies. One major concern identified in the study was the gap between knowledge and the actual practice. Although students understood the importance of hand hygiene, this knowledge did not consistently translate into proper behaviors in the clinical setting. The study also identified confusion between when to use alcohol-based hand rub versus traditional hand washing. Another important finding was that COVID-19 temporarily improved compliance, but the improvement may not be long-lasting. Overall, this article suggests that education alone may not be enough to create lasting behavioral change. The second article examines alcohol-based decontamination of gloved hands. This was a level 2 randomized controlled trial. Researchers used three control groups. First group, alcohol-based hand rub. Second group was the gold standard of removing your gloves, hand washing, and donning new gloves. And the third group was usual care, which was the hand practice of choice of the individual. It also included semi-structured interviews with open-ended questions. There was 26 healthcare professionals that participated. The purpose of the study was to evaluate the effectiveness of applying alcohol-based hand rub directly to gloved hands compared to the gold standard practice or the usual care. The findings showed that using alcohol-based hand rub reduced bacterial contamination on the gloves. The gold standard practice still produced the best outcomes, but the alcohol-based intervention saved time and improved compliance compared to usual care. The study also recommended additional research related to glove safety and effectiveness. This study highlighted the gap between ideal hand hygiene practices and what actually happens in real clinical settings. Healthcare workers often struggle to consistently follow the gold standard because of time demands and workflow interruptions. Participants also reported concerns about wet gloves and drying time after applying alcohol-based hand rub. Other concerns included patient safety risks, contamination from improper glove use, and possible glove damage. The researchers concluded that more studies are needed before this method can become a standard practice. The third article was conducted in Ethiopia and used a mixed method cross-sectional design. This study was considered a level 3 evidence because it included descriptive and correlation components. Researchers used self-administered questionnaires along with semi-structured interviews, audio recordings, and note-taking. 256 participants from 3 hospitals with 6 months minimum patient care experience. The purpose of the study was to assess the level of hand hygiene compliance among healthcare providers. The study found that compliance was very low, with only about 20% of participants following proper hand hygiene practices. It also identified the need for improved infrastructures, including sinks, supplies, and training programs. One major concern in this study was, once again, the gap between knowledge and actual practice. Healthcare workers may understand proper hand hygiene but still fail to consistently perform it. The study also emphasized how lack of resources and poor infrastructure affect compliance. Additional barriers included workload, limited supplies, and unclear effectiveness of current training methods. Overall, the findings suggest that improving compliance requires both education and stronger healthcare system support. The findings from these studies have important implications for both nursing practice and nursing education. For nursing practice, healthcare organizations should focus on improving hand hygiene compliance to reduce healthcare associated infections. Barriers such as workload, lack of supplies, and glove misuse should be addressed. Leadership and positive role modeling are also important in promoting better compliance among the staff. For nursing education, more hands-on training and practical demonstrations are needed. Nursing programs should also focus on helping students bridge the gap between knowledge and the actual clinical practice. In conclusion, hand hygiene remains one of the most important infection prevention measures in healthcare. However, compliance with hand hygiene guidelines continue to be inconsistent despite education and global recommendations. The literature suggests that long term improvement requires more than education alone. Practical interventions, leadership support, and proper infrastructure and evidence based strategies are all needed to improve compliance and reduce healthcare associated infections. This concludes the presentation. I thank you for your attention and your time.